Hello guys, for those that don't know me, my name is Nisa. I've been a labor and delivery nurse for almost 2.5 years. I am also in graduate school to become a certified nurse midwife. So I'm here today to talk to you about an epidural. A lot of moms have been asking me on Instagram about an epidural and what it is. So I made some notes and I guess I'm going to talk about it today. So let's see. An epidural during labor is to help, is given to you to help with pain. So it's either given by a doctor, not your OB, or a certified registered nurse anesthetist. Sorry, that's my boy. It numbs the nerves from about your chest level or bra level to your knees. The plan for is that 80% of your pain is to be taken away. So basically, the epidural will take about 80% of the pain away, but you will still feel pressure. As the baby moves lower and lower down your pelvic, you're gonna feel the pressure. Usually that pressure feels like you have to poop. You should still be able to move in your bed. So a lot of people think that the epidural will make you completely numb and you can't move. That's not true. Some people can still move their legs. I've seen patients that cannot move their legs at all, and then patients that can move their legs like they don't have an epidural at all, but they still don't feel pain. Most of the time, epidurals are placed and then it's bolus, which means they give you a large amount of medication at once, and then it is set up on a pump and continuously give you medication. So the anesthesiologist or CNA puts in a catheter or this little thin flexible tubes into your epidural space. Then it is placed on a pump that drips in medication until you have your baby. And then after that, the doctor, your OB, will check if you have any tears and they will repair you. And then we as a nurse will turn off your epidural pumps. And then you should be able to feel your legs in 1 to 2 hours. It's different for everybody. But so the epidural space. Your brain and spinal column are covered by several membranes. So they go between two of those in the epidural space. So think of it like this, a banana. They're trying to put the medication in, they're trying to slip the medication in between the peel and the banana. The epidural space is before your spinal column, so the needle is not going to go into the same space that holds your spinal column. But, however, your spinal, so as I was saying, however, it's still near your spinal cords, and sometimes the tubes can still brush up against the nerve as they thread it. That happened to me the first time that I got epidural with my first child. I remember them threading the tube in, and all of a sudden my right leg just feels like the shooting pain. It was so weird. I was so scared of it the second time, but it didn't happen the second time. One of the side effects of an epidural is the numbness and your legs feeling very heavy. A lot of my patients, not a lot, some of my patients gets freaked out about it, but man, if my legs is numb, I'd be so happy. I would just go to sleep. Another common side effect can be itching or your blood pressure falling, which is why before we give you an epidural, we tend to bolus you with a lot. So as I was saying, your blood pressure can drop pretty low. So that's why we always ask you to let us know 45 minutes to an hour beforehand, so that we can bolus you with a lot of fluids so that your blood pressure doesn't drop. Another side effect that you can experience is nausea. I think I tend to get really nauseous as well with an epidural. So that's something to look out for. So what else? The anesthesiologist can give you something for nausea if you experience it. So at the hospital that I started out with, before every single epidural, we are used to giving Pepsid and Reglan. That's to help you not be nauseous and nauseous or vomit during an epidural. But apparently, now that I'm working somewhere else, that's not the protocol anymore. Like, so as I was saying, not all of your hospital give you pre-epidural medication. I was doing that when I first started at this hospital, and because it's in the orders, and I've been doing it for so long, and one day I just found out that wasn't what they do, and they were like, well, your patient must love you for doing that, but you don't have to. So I was like, that was kind of weird. So the most common long-term side effect of epidural is back pain. Not like a long-term thing, but you can it can feel like you have a bruise in that area for like 10 days. That happened to me the last time I got an epidural. Like the day after, I was like, man, it really hurts there. Like it just feels really sore and everything, but it went away. And then a lot of people, like my mom, and then so yeah, a lot of older people think that or a lot of older people told me that I shouldn't get an epidural because it can give you like long lifetime back pain. But I tried to look up studies on that, and there's no studies that show that it's even true. Having a baby is rough on your back, all the sitting, feeding the baby, picking the baby up, handling car seats and everything. So I think that's why your back's gonna hurt. Let's see, but then there's also other epidural risks that, when you sign a consent form for it, it's on there, like spinal headache, which is when small amount of spinal fluids leaked out, and then if that happens, then they can do like it's called blood patch to help with that, and then let's see what else. So then a lot of people also ask me if getting an epidural hurts. So the doctor or the CRNA usually will try to numb you first with this medication called lidocaine. Before we usually tell the patient that that is the worst part of the epidural. So basically they will stick a small needle in your back and inject that medication in, and it will burn like a bee sting, literally. So just breathe through it, and then after that you should just feel pressure. However, I try to let my patient know that if they do feel pain, to let the doctor know, because the second time I got my epidural, he did numb me, but when he tried to put in my epidural, it hurt so bad. I was trying really hard not to cry because I know him. Back to my story. So the second time that I got my epidural, I've been working at this place, so I know the doctor that was giving me my epidural. So I didn't want to seem like a wimp, but even though he numbed me, it hurt so bad that I was literally gripping onto the bed and crying. So he had to numb me some more, and that hurts as well. But after that, it was okay. And it also ended up being the best epidural of my life, because I did feel pressure of the baby coming down, but he literally slipped right out. Like, I didn't even feel that. I didn't feel the ring of fire or anything. It was an awesome epidural. Sorry. So another thing that a lot of my patients think is that getting an epidural will slow down your labor. I actually don't believe in that. I was 3 or 4 centimeters when I came in with my second baby. I got my epidural, and right after that I was complete within an hour. I think people think that because a lot of people get their epidural and they don't feel the urge to push, so then it can take a while for them to push. But once you have an epidural, there's this thing called laboring down, and it works wonders. I think that's all I have to say about epidural. If you have any questions, just direct message me, and I'll try to answer it as best as I can.